As many men get older, they start to have different urinary symptoms, whether or not that's waking up at all hours at night to use the restroom, the force of their stream is not quite what it used to be, or maybe they're having to go to the restroom more frequently than some of their peers. And this can be anything from an enlarged prostate or something that's a little bit lesser known is called a urethral stricture, which is basically scar tissue that's built up inside of your plumbing system is how I usually describe it to patients. And this requires a completely different mindset when it comes to management as opposed to like a simple enlarged prostate. If you have the diagnosis of a urethral stricture, when you come to my office, we'll start with one of two things. We'll either do a cystoscopy in the office, which is just a simple camera study where we pass a camera into your bladder and we look to see if we can identify the area of scar tissue. If we can't advance the camera into your bladder because of a blockage, then I'll take some x-rays in the office and then we'll sit down in the clinic room and I'll pull up your images and we'll sit down and have a conversation about what are some different things that we can do to treat that. Some of the options for patients with urethral stricture disease include non-surgical options such as dilation, so teaching a patient to pass a small catheter that will continually stretch the scar tissue out and allow them to have relief from their symptoms. Some of the surgical options that I offer, one is a drug-coated balloon. This is an outpatient procedure, usually takes me about 10 to 15 minutes. We go in, we stretch the scar tissue out with a balloon. There's a medication that's coated on the outside of the balloon that helps prevent the scar tissue from reforming. This is a fairly new technology that's at the forefront of urethral stricture disease management, and I'm happy that we offer it here at UAMS. And then after you get past that, there's more invasive options, which would include urethroplasty. And this is a surgical reconstruction of the area that's affected. And this could be anything from just cutting out the scar tissue and sewing back together the two healthy ends of your plumbing system, or it could be pretty invasive where we actually take tissue from the inside lining of your cheek and use that to recreate completely that area that's affected. For patients who have a urethral stricture, I think that UAMS is the perfect place for you. I'm the only person or only provider in the state of Arkansas who's specially trained to treat urethral strictures. I did a fellowship in urethral reconstruction or male reconstructive urology at UT Southwestern in Dallas, Texas, and I did hundreds of cases involving urethral stricture over that short 1-year time frame, and I see this on a very regular basis in my day-to-day practice.